Thank you for coming to the VA Forum, being hosted by the VA. Mr. Vince Kane, Wilmington Director, Jackie Hinker, Pat Carney. There's several other ones you hear. I probably don't know all your names, but I see freeholder, Jeff is here, and our certified service officer, Ginny Tomlin, and her assistant, who will lie when you call her and tell her Ginny's not available. Evelyn. But again, thank you for coming, and I want to thank Jackie and Vince and Patrick for having it here. We started this, I don't know, Vince, when was that we started Town Hall? 3 years ago?
It'll be 2 years in May. Yeah.
It was one of the first Town Hall meetings.
Yeah.
And went from there. Well, hopefully you're going to get some good information, and I'm sure if there's a question, I think Jonathan will answer that. Right, John? Yeah. Right. Oh, look who's late. Freeholder Jerry Thornton and his lovely wife. You could have left him home. All right, get you started. Everybody stand and face our flag. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Jackie, it's all yours.
Hi, I just wanted to introduce a couple of people that I'm not sure that everyone is familiar with, that's in the room from the Wilmington VA Medical Center and from the Southern New Jersey clinics. So when I say your name, can you just raise your hand? So we have Dr. Corey Feiner from the Northfield Clinic. We have Miss Cindy Murray, who is the clinical operations nurse manager of the Northfield Clinic. She's got several titles. Michael Francis, who's not from the VA, but he is from Congressman Van Drew's office, so definitely hello to you, sir. Our nurse executive, Kathleen Craig, raising her hand back there. We have Jody Seawright from the Care in the Community. We have Mr. Bill Griffiths, who is the director of the CBOCs. Karen Van Orden from the Cape May Clinic. Is that everybody? Who did I miss? Oh, shoot. And a brand new public affairs officer from the Wilmington VA Medical Center. We have Brendan Mackey back there in the corner. We're very happy to have Brendan here with us tonight. So without further ado, I'd like to introduce Director Vince Kane of the Wilmington VA Medical Center to fill you in on what's new in Wilmington and what's new in South Jersey.
Thanks, Jackie.
You're welcome.
Good evening. I'm just glad I wasn't late and got called out.
Thank you.
Rub it in.
So the thanks really goes to the Legion, to Harry and Vince for hosting us. This is an important time for all of us, and I appreciate the opportunity to be with you again tonight to kind of talk a little bit about where we are with the clinic, as well as some changes and things that are going on in Wilmington that I think everybody needs to know. I do like this to be more conversational. I don't really want to be the one standing up here kind of doing a talking head. So I really want this to be comfortable, and as we've said from the beginning, this clinic is yours. It's not ours. We have the privilege of managing it and making sure that the health care is second to none that we do in the clinic, and that if there's things that we can't do as Wilmington, that we have good partners in the community to make sure that you have access locally. And I know our team has been working on that pretty diligently over the last 18 months to try to improve those partnerships so that we can get more services into South Jersey. We don't have a hospital, but having clinics that have core services like primary care and mental health, and we're planning to have rehab and some other specialties here. But for the things that we can't do, we want to make sure that we have quality partners that we can refer you to, and that we can make sure that that care stays coordinated. So to me, it's an exciting time. The thing that we want to do with you is make sure when this clinic becomes operational They're called community-based outpatient clinics. But at some level, they've kind of gotten to the point where they've been more focused just on the clinical and not on the community. And that I think we have a commitment here with the General and Cape May County to make sure this is a resource that goes beyond just simply providing medical care. And so we have that opportunity to help shape that. I had the fortune this week to get a chance to meet with one of the acting leads for the Veterans Benefits Organization over Philadelphia, which is responsible for this community. And he told me that he is eager to work with us, that we told him we missed him. In the events that we do in the community, having VBA with us is really important. And as I've talked to him, I said, as we set up these clinics, we would love the VBA staff to be here in the clinics with us. They're community outward-facing teams. Would be really good to have them be part of what we're doing. So it is really more of a community clinic, a one-stop, so if a family or a veteran has concerns, there's resources right there that can help. We can certainly do a lot of that through the virtual care programs, but there's something to be said about having some of those services face-to-face on a regular basis. So there are some things that we're doing. At Wilmington, just before I dive into all the clinic things, Brendan has joined us. Brendan is our new public affairs officer. I'm proud to say he's a veteran. He knows this community very well. He's worked prior to joining us with Senator Coons over in Delaware. He's vacationed and spends time in South Jersey with his family for many, many years.
C point.
There you go. He's excited to be with us. I don't know if Senator Coons is excited about this. I don't know if I'm on the good list or the bad list, but I would assume it's not the good list. But he's going to be great. We're looking forward to having him be a part of what we do, interacting with you, talking about things that are going on, and making sure the information is flowing properly between the medical center and the community. So I think Brendan's going to be a real positive. Many of you have met Bill Griffiths in the prior meetings. Bill is in charge of our primary care and ambulatory care services. He is working with the architects from Cape May County on the design and the layout of the clinic. Bill is also responsible for making sure that we get the right clinical services in to the clinic and has really been leading the effort and knows many of the details about how we're going to try to maximize this 10,000 plus square feet clinic to meet your needs. Jody Seawright is here with us from Care in the Community. She, along with Bill, have been working with the providers in the community to kind of make sure if there are things we can't do, that we have these agreements in place so that we can try to get the care coordinated locally for you as best we can. So Jody is committed. She, along with our nurse managers, Cindy's here tonight from Northfield, that are navigators that we've put in the clinics. Nurses will be part of this and help to coordinate that care so that, we make sure that people don't fall through the cracks and that care stays coordinated. The models that we're developing in Northfield and Vineland are models that we plan to make sure are part of what we do here in Wilmington and really our standard practice. And then lastly, Kathy Craig, our new nurse exec. She's with us almost a year now, right? Kathy joined us from Philadelphia. She has 34 years of experience, knows this community, knows the Delaware Valley extremely well, and has really kind of hit the ground running, helping us advance nursing practice at Wilmington and all of our CBOCs. So we've got a very committed team that are eager to work with you and help kind of make sure we move forward. Let me give some other quick updates about things that are going on that I think are important for you to know, and then I'll ask Bill to talk a little bit about the clinic and how we're progressing. We did bring some visuals tonight, so folks get an opportunity to look at the type of quality and dignity and the modern aspects that we're looking to have in the clinic. So you get a sense of how it's going to be laid out, what kind of office space will be available, what type of clinical exam rooms. When I walked in tonight, somebody talked to me about making sure that, you know, as we look at what we do here, lessons learned from other places, that group rooms are bigger, you know, that it is more accommodating for activities that go beyond simply the healthcare piece. So we definitely are committed to doing those things. I know the county is committed to doing those things, and we want to make sure that all that's in place for you. We are preparing for some of the changes with the Mission Act. We've covered this in the last meeting. The big changes there is the guidance about the travel times and the distance as well as wait times. In the end, I think the Secretary's been pretty clear that where veterans get their care is really going to be put in the hands of the veterans. And that for VA, what we have to focus on is making sure that how we deliver our care today makes an impact on where the veteran chooses to get their care tomorrow. So we have to be working on continuing to try to improve our quality, continuing to improve our access, and making sure that the entire experience is a better experience. We have begun discussions with Philadelphia and Coatesville to talk about veterans in the Delaware Valley move about. People come to the shore during the summer months. And it's not just that group, but in general, a veteran should be able to present to any one of our clinics and get the care that they need at that clinic, regardless if they're enrolled in Philadelphia, Wilmington, or Coatesville. That's not how we set the clinics up initially many, many years ago, but I think we're committed to moving to that. The network leadership has been committed to moving that. We're trying to get the folks in the clinics to understand that. So we need your feedback. We want to make sure that regardless if it's a Philadelphia patient, a Wilmington patient, a Coatesville patient, if somebody presents to one of our clinics, we want to make sure they get the care that they need and that care stays coordinated. The same things we're doing with our external partners, we need to do with our internal partners. And so we're committed to making sure that happens. We're committed to making sure that the access is what it needs to be, so that if somebody needs to be seen urgently, we can do that. We were fortunate recently. We got funding from our network to set up virtual care. Our new chief of staff is in charge of primary care for the entire network. He joined us from Philadelphia, where he had been practicing for many years. He is now going to be working with us so that we can set up not only expanded primary care services throughout our regions, but that we would have virtual ability, which would mean that if a veteran, if a provider called off, we could have a doctor connect virtually to engage with that veteran so there wouldn't be that rescheduling that sometimes occurs. If a veteran needed to be seen at home because they weren't able to get in, the capacity under this new model allows us to do that. So we're finding ways to make sure that we're the ones moving, not you. And again, to make sure that quality is at a level that is as good, if not better, than the community. They're the things that we're working on. We've made some hires. We'll continue to grow our presence in South Jersey. We've been expanding our mental health services. We still have some additions that we want to make, but I think the feedback has been better than what it has been in the past. Our suicide prevention coordinator is very active in the community with our outreach teams. Our justice and VALV folks are actively engaged. And I think you can see the difference. When we started these meetings, where's Vince? I lost him, there he is. Vince and Harry, 2 years ago, you didn't really see many VA staff. Tonight you see staff from multiple clinics. Our motto has been pretty simple. It's really, how is it that we're in the community with the community? So there are some of the key things that are going on. The things we remain focused on in Wilmington is how do we try to make sure that every day in every service we put our veterans first? How do we make sure it's a better place for our employees so that we can continue to attract and retain good quality staff? But not just quality staff, staff that believes in the mission, staff that understands what's it mean to take care of veterans. And then how do we try to pursue making sure that quality, safety, and excellence are at the heart and soul of everything we do. And then lastly, which is something that hasn't always occurred, is making sure that we walk the talk, that they just can't be words, that they have to be actions that get lived every day. So we're committed to doing those things. We're moving those things forward. We're growing. We're trying to make sure we have more services in the community. We're moving away from a model where everybody had to go to the medical center to a model that how do we get into the neighborhoods and into the communities to understand you so that your health care is easy to access and of high quality. We're growing some new services in Wilmington. We're expanding our palliative care programs for individuals that have been struggling with chronic illnesses. We're expanding our hospice and end-of-life services for veterans that are at that point so that we can provide more services not only at the medical center, hospice services, but also in the homes when veterans choose to leave and they want to leave in the comfort of their homes. So that's something we're aggressively working on. We've partnered with Philadelphia around trying to grow our surgical services. Wilmington has not had a strong or robust surgical program for a number of years. It doesn't make sense for us to try to kind of do that again by ourselves. So we're partnering with Philadelphia, we're sharing faculty, we're co-recruiting, and again, we're going to make sure that staff and surgeons are available both in Philadelphia and in Wilmington if our veterans need those services. We've continued to grow our relationship with Rowan University. Later this month, I'll be meeting with them to talk about ways that we can get residents and we can work with them on some of the recruitments we have so that we're able to attract and retain high-quality providers who can both teach as well as develop the next generation of providers. And that's just not on the medical side. Kathy is working with the University of Delaware, and we've begun discussions with Stockton as well as Rowan for nurses and social workers and making sure that as we're training new young professionals that VA finds a way to attract and make them part of our team as we go forward. So lots of things going on, things that are important for you to know about. Brendan will kind of spearhead the communications as we go forward. And again, it's got to be together, one team, one fight to make a difference for you and to show our gratitude to you and to your families for the service that you not only gave during your time of service, but for many of you who continue to give of yourself today in helping these communities. So that's kind of what we're doing. It's a little bit different than what Wilmington might have done in the past, but we as a group feel this is the right thing to do. It's the feedback you gave us that you wanted us to do. So I'm working with our teams to try to make that the day-to-day reality. So with that, I'm going to be quiet and let you guys, yes?
When's all this going to be implemented about us being able to go local as opposed to?
So we've already started. We've begun that communication. Cindy can tell you there's been clear dialogue to our staff that if somebody presents, we see them, period.
So the people that, and you know what I do here.
Yes.
My guys, they get scheduled and from where's your scheduling come out of? It's not coming out of the hospital, correct?
Well, scheduling, it does get coordinated, but each clinic does some scheduling.
Because we're still making trips to Wilmington that we could go to Vineland, Northfield, or even locally to have things done as opposed to that 2-hour trip.
If that specialty is in that locality, absolutely. I think at times what happens though is that there are certain specialties that are at Wilmington, or there are certain procedures that aren't done in clinics.
I understand that part, but I'm saying the parts that we know that are happening at the C-Box, who do we call to fix that if it's somebody's getting sick?
So I would ask you to work with Rich and Cindy, our nurse managers. I mean, I know right now we're running a shuttle that goes between Northfield and Vineland. You know, because Vineland does some audiology and has some services that Northfield doesn't have. And so we adjust it. So Rich and Cindy, if you'd raise your hand, they can do that, and then they'll work with our scheduling folks to try to minimize people traveling unnecessarily.
Okay, can I ask you another question? You have two VA Express vans in the Northfield and Vineland. All they do is go to Wilmington? They don't retrieve locally to bring people into those CBOCs? Because I'm still getting calls from Atlantic County and Cumberland County to transport veterans.
No, they don't do home transport, if that's what you're asking me.
Okay, is that a service that sometimes might be considered?
We're not funded to do that at the moment.
No, we're not either.
We do look at trying to partner with different agencies to kind of help us with that. Actually, from the last meeting that took place, there were some folks from Cumberland County, Atlantic County, and Cape May, and I know Cape May's got some challenges with public transportation. We talked about some meetings to kind of come together with a team looking at that to see how can we put something together that is more beneficial to our veterans.
We had one of those this morning.
Yeah, so the idea is let's learn what's out there, what's missing, and then we'll plan together to figure out how do we try to mitigate travel as a challenge for our veterans. Yes?
Hi, Vince. Given we are in a seasonal resort area, you know, in the summertime, our population explodes, and we also get a lot of veterans. Veterans have gone to the Coast Guard base to get treatments and walked out of there with nothing accomplished. What considerations are we going to consider with this new CBOC to expect a heavier workload for that CBOC when the seasonal veterans hit this area? Is there consideration on that?
Yeah, I mean, that's part of the planning. We're looking at the staffing models. Pardon me?
That was never brought up before. That was never brought up about these seasonal veterans coming through here.
No, we discussed
Yeah,
that.
no, that's...
We have discussed
Maybe
it.
you have, but I haven't.
No,
We haven't.
so yes, I mean, that's been factored in.
That was behind closed doors. We'd like to hear it too.
Yeah, no, I mean, our plans are to kind of make sure more services are available in the communities where the veterans are. And we, you know, we're already doing some of this in Northfield. We know people travel to Atlantic City and we're taking care of them there. We've been adding staff. We've been growing our PAC teams. You know, we plan to continue to grow that as we get more veterans that sign up and become part of the VA system. We're able to add more staff to make sure we take care of their needs.
Just warning you.
So we're actually even recruiting.
That could actually explode with it. One thing is, you talked about the Secretary Wilkie.
Yes.
There's a good possibility he's going to be in Wildwood during the VFW State Convention to talk to the veterans.
Good. Good. I hope you guys tell them why this stuff is important and let them know some of the things that we're working on.
You know, I'm all for this. Keep going. It's done a good job. Thank
No, you guys are doing the good job. We're just listening and making the adjustments. Vince.
This is not a question. Well, some of you have been using the VA longer than I have, but I will tell you something. Like Vince mentioned, the first town hall meeting here was in May, right after we started, and he does talk the talk and walk the walk. He told him the first meeting he's not going to BS us. If he can't do it, he's not going to do it. Everything he has said to me, he's doing. And people are out there, well, it's taking too long. You waited this long, good things come, takes a while. And I really think, Vince, with what you're doing and your staff, the staff's making you great and you're making that staff great. And on behalf of veterans that I know, I want to thank you for your work.
Well, actually, the credit goes to the communities and to the staff. My job is really just listening and trying to make sure we can marry up the resources. So it takes all of us. You know, the saying is it takes a village. It will take a community to make sure we do it. And that's the way it should be. All of you that serve left neighborhoods and families from your community, and so the community needs to be a part of the way in which we care for you as you come back. So we're excited to be a part of that approach and that model. And we know that's not always been the case, but we've gotten good support from our network. We got great support from you, and we plan to continue to grow this to meet your needs. We know there's not a hospital here. We get the burden that it is to travel to Philadelphia or to Wilmington, and we'd like to make sure we have as many services here that we can get to meet your health care needs and to support the community knowing what you've done and making veterans a bit more prominent in these communities. I mean, Cape May County, if I'm not mistaken, from stuff that I read, I know data always changes, but has the highest percent of veteran population in the state. Maybe not the highest numbers because of our size, but percentages, we're the highest in the state. So we need to make sure we have a presence here.
Or better with the BVA. Are you talking about having CMPs down this way? Or
well, so that's contracted, so I don't know how that's all going to happen. So no, we didn't talk about that. What we talked more about was, you know, we've done a lot of outreach events, and the more successful outreach events, and you know, you guys correct me if I'm wrong, have been the ones where VBA and our outreach team and our enrollment teams are there together. So that if a veteran or a family has a benefit concern, they can come to that health fair and that team addresses it right there and the follow-up is right there. So we'd like to see more of that. We've done some hearings remotely using virtual care in Northfield. We'd like to get that expanded to Vineland to try to reduce the burden. But we've not talked about CMP. I know there's a contract that they have, and there's some rules about that, and who's qualified or certified to do those, and it can be up to 100 miles. So we didn't discuss that. We talked more about the day-to-day, having VBA more active and available to you in our clinics as we try to go forward. Yes?
Really quick, talking about the staffing for the new clinic coming in, when does that staffing start? And if it starts before the year, are they going to be in Cape May at the Coast Guard base, or are they going to be coming in, or how's that?
Well, we'll probably have them where we have higher numbers, but we've already started to recruit them. Bill, you can talk a little bit about, you know, some of the recruitment we're doing for primary care and nurses in the clinics. We're looking at growing our mental health presence as well. So we're already actively recruiting primary care doctors that we'd like to bring on now, kind of anticipating that when we open the clinic, we don't just want it to be a nice building. We want to make sure that the services are there. So some of that recruitment is already underway. We know that right now, Dr. Golden, who's a phenomenal doc, isn't fully paneled. He's helping in some other places, but we're going to add additional providers into Cape May, even though the numbers don't support it at the moment, so that we can prepare for what's it going to be like when we open the clinic. Because we do expect some growth once the clinic opens. We think that that's going to help get more veterans to think about VA. And you know, the outreach team is doing its best to get veterans engaged. We need you to get veterans engaged. I mean, we talked about this the last time we were together. If you look around the room, we're all getting grayer. We've got to find a way to attract and bring in some of our younger veterans, and find ways to make sure what we're doing is meeting their needs. But you know, we have to make sure that we're serving younger veterans. The other opportunities are female veterans. I mean, I think there's been missed opportunities there, and you know, through the partnership with Philadelphia and Penn, there's opportunities to get some specialists in that area that we want to make available locally as well. So I think we've got to together think about how we want to attract younger veterans and more female veterans to VA. Well, you want to take a minute or two just to kind of talk about what we're looking at the clinic, and I know what we're 25% design at this point?
Just about, yeah. Hello, for those who don't know me, my name is Bill Griffiths. This June I'll be celebrating my 20th year with the VA. I spent 18 years at the Lebanon VA in Pennsylvania, and this will be my 7th CDOC that I've been a part of activating, so I'm pretty excited about that. As Vince stated, we're about closing in at our 25% design mark. That'll be coming up about the second week of April. Rich and myself met last week with the architects hired by the county to start the design process, and we're starting to work with them to make sure we have all of the right pieces of the puzzle placed in the clinic. The clinic itself, as you all know, or maybe you don't know, we hope to open by next April, sometime next spring, a little over 11,000 square feet in the Rio Mall, Rio Grande area. And some of the keys of the clinic, and the pictures up front you guys can check out a little bit later, but some of the things we're trying to infuse into the clinic is a real franchisable atmosphere. Basically what that means, we would like to see our exam room space be usable by many different specialists, primary care providers, what have you. And the other nice thing about the clinic design we're moving towards, not only is it veteran-centric, but it really promotes a lot of staff communication. So what that means to us is a lot of efficiencies, paperless consults, curbside handoffs, things like that. So for those of you who have ever been at Disney, you have the on-stage, off-stage atmosphere. So the business in the back will really be a group atmosphere with all of our staff seated conjointly together, communicating about veteran needs and being able to infuse those needs right into the exam room where the veteran is. So our hope is that a veteran can enter the clinic, be greeted in an exam room, possibly have their blood drawn in the exam room, the nurse triage in the exam room, a primary care appointment in the exam room, a specialist appointment in the exam room. So instead of a veteran being bounced around the clinic, we'd like to bring the care to them. The other nice thing we're planning on, and Vince has promised us this is going to happen, the clinic, we hope, is going to be wireless.
Yes.
So the cool thing about that is our staff will be mobile. We won't be tied to computers anymore that are chained to the wall. And we'll actually be mobile with laptops. So that's the kind of thing that's going to allow us to bring all the care you need into your exam room. So there's going to be a lot of efficiencies for us. Virtual healthcare, Vince talked a little bit about the virtual capabilities. Our hope is that every exam room will be outfitted with virtual monitors. So basically what that means, if your primary care doctor wants you to talk to a cardiologist, given the capacity at Wilmington, we can bring a cardiologist into that room within minutes, given the capabilities. So it'd be really nice to have a conversation between the veteran, the primary care provider, and the cardiologist to talk about what the next step of your care would be. Right now, the design itself, almost 4 times the size square footage in what we have in Cape May currently in the Coast Guard base, a little over 3,000 square feet. We're going to be over 11,000 square feet in Rio Grande. 4 to 5 primary care exam rooms in Cape May. We're going to be pushing 15 to 17 exam rooms. There was a question earlier about how we're going to right-size the clinic for the summer traffic. Vince is committed to us working with fee basis and contracted providers to bring them in when the load gets heavy during the on-season. So those are the kinds of things we're planning for now to make sure that the veterans' needs are met in a timely fashion in the heat of the summer. What did I miss? Are there any questions? We've been having some focus groups at Cape May. We've been meeting veterans in small groups, 8 to 12 at a time, listening to their needs. Some of the things that we're going to be infusing into the clinic now, and we're interested in hearing what you have to say. Optometry will likely be present in the clinic, physical therapy, mental health obviously, and a lot of specialties coming out of Wilmington virtually. So those specialties that don't necessarily need a provider to touch you, endocrinology, nutrition, chaplain service, perhaps social work, cardiology. Those are the types of services we can bring into the clinic. And the other point I want to touch on again that Vince mentioned, our goal with all of this is to really create a network of services throughout southern Jersey. Short of having a standalone hospital, with Jody's help and Cynthia's help in Northfield, we really believe we can bring all the services you need right here to South Jersey.
So the other 2 bill we talked about, I know, was having more of a rehab presence here, as well as the chiropractic, so I don't know if you want to.
Yeah, so rehabilitation will be in the clinic, physical therapy. We're still working on sizing that space. Our architects are telling us we should shoot for about a 500 to 600 square foot physical therapy room. We do plan on having rehab in the clinic, and pain management Vince mentioned as well. That'll likely be shared between Northfield and Cape May. Chiropractic care is something that's very high volume for Jody's shop. The Wilmington Medical Center is actively recruiting for chiropractic providers in the community, so as soon as we bring them on board, you'll likely see a presence in Cape May or Vineland, Northfield perhaps. So those are services that we're recruiting for now, getting ready to put in play once this clinic's activated next year. Any questions? That's right.
Yeah, Joe Orlando from the Veterans of Foreign Wars. Will this be a 5-day or a 7-day effort to provide services for veterans?
We're looking at ways to expand to 6 days possibly with Saturday clinics. Our goal is to look at opportunities to extend in the evening to begin with. But we really got to take a look at those clinics to make sure they're going to be utilized by, by our veterans. Historically, Saturday clinics are not well attended. So obviously we want to make sure we're using our resources smartly. But we've talked about Saturday clinics and evening clinics.
Question. I'm Jerry Thornton, Freeholder Director. Now, in Cape May County, 48% of our homes are second homes in Cape May County. And we have a population in the summertime, average weekly population where, the county is 96,000, we go up to more than 700,000 during the week. Now, my question is, those people that are here, particularly those residents that own homes here, when they go to the clinic, although they're being cared for up in Wilmington or someplace else, or is this clinic going to have access to their records up in those other facilities?
Yeah.
I mean,
Yeah, that's exactly the things that we're working on right now, so that you can do it. You can do it now, but it's very cumbersome. We're trying to make it simpler.
Okay.
So we've got people from behind the scenes to try to make it simpler. So that if you're seen here, then the doc in Philly can pull it up and see your labs.
Okay, good.
So the other thing that I'd like to talk some about it, and maybe we can have Jerry or Jeff join us for a minute or two to talk about some of the efforts in the community that for justice-involved veterans or mental health. I mean, one of the things that we've seen that's kind of been challenging here in all of South Jersey are mental health services and the availability of the core general mental health services as well as substance abuse services. We've had some challenges when a veteran has needed care. It's difficult to get them into a community hospital. Especially if they're not going on their own volition. There are limited resources, and we don't think it makes a lot of sense to try to send folks up to Lyons. And then sometimes it doesn't make any sense to try to get them to Philly or Coatesville, which is where we have our mental health beds in VA. So we are going to need that partnership, and we're going to need to get your feedback about what's working, what's not working. Mental health really is a 24/7 concern, and we have to be in the community and with the community to make a difference. And there are some things that we don't have, there's things that the community doesn't have. How do we kind of blend this to make sure that we have the right types of supports for our veteran community? So we need to make sure these conversations spend some time looking at that and thinking about that so that we can together come up with a better model. I think we're doing some things very well. I'm excited about some of the great partnerships that have been set up, but there's still gaps. And we have to figure out together how do we close those gaps.
Vince, I got 3 short questions. One is, the veteran wakes up tomorrow morning at 11 o'clock. What is the blueprint if he's ill and clinics are closed?
So I can't hear you, I'm sorry.
A veteran wakes up tomorrow morning at 10 o'clock, the clinics are closed. What is the blueprint so family members and veterans know what to do? Because if you go to the hospital, you only have 3 days to notify your primary care, or else you can't put in collection because nobody's going to pay your bill. My second question is, do we have a blueprint? I've had 3 cases in the last 2 days of veterans committing suicide. What do we do on a Saturday night at 9 o'clock if the veteran commits suicide? Does the VA have a blueprint that says, gonna have a gynecologist there for our female veterans? Are we prepared now to send them to outsource to gynecologists? Because that seems to be the answer, what they're doing in rural areas around the country. They're outsourcing women's care because the VAs, they're 50 years behind the men taking care of the women. I know it's a lot, but
Yeah, so let me try to take them one at a time. So there are some blueprints, but I think, and this is where Brendan's going to come in to help us, I don't think they're well communicated. You know, for what do you do, and I'm assuming when you talk about off hours, you're talking about mental health crisis.
I'm talking about from 4 o'clock on Friday afternoon to 9 o'clock on Monday morning.
For everything?
Well, suicide and
Yeah,
health
and
care.
some of this gets addressed in the new Mission Act with certain opportunities to access urgent care, which VA has been behind on. We have not, we weren't keeping up pace with the community in setting up these urgent cares, but now we will. I think the virtual care that we're talking about, as I've worked with the team in Wilmington, we've talked about trying to make that available in the evenings. But there is those provisions out there that somebody can present if it's a true emergency to a local emergency room, and then they call us. Yeah, and they call us.
But we don't advertise that. And they're available for suicide.
Yeah, so we actually, interesting, we just did a group, sort of a performance improvement group at Wilmington that included folks in New Jersey, in our clinics to talk about this, and we're actually designing a letter now that will go out to all of our veterans that kind of talks about how do you use emergent services and what are the steps that you take. The other side of that, Joe, is we also have to talk to the providers so that they understand. And we've had some meetings, Jackie's been a part of these, where we've gone to Atlantic Care and we've gone to Inspira to say, listen, if a veteran presents, call us before you send them to collection or you send them, you know, or you bill their other service. Let's make sure that if they're eligible for VA, we do that first. So we have begun that education, not just with the veteran community, and we will get some communication out to folks and make those things more available and get them up on our web pages. But also, we've done it now with our partners so that they understand that if somebody presents, here's who they call it, the VA, so we can try to mitigate the problems. Most of the calls I get about dissatisfaction have nothing to do with the care. It has everything to do with these other processes that should be supporting the care that are very onerous. So that's why we've been putting these things together to try to make it better. The stuff we're doing on mental health after hours, I know everybody talks about the crisis line, and that is really important, and it does connect folks that need that urgent engagement with a provider 24/7. But we also are talking about how do we get local engagement. One of the things I'm most proud of is the work that has happened in Cape May County as well as in Atlantic County, where we now have these crisis units, and VA is a part of that. If somebody's in crisis, how do we get the veteran connected to that unit so we can get them to a safe place, do an evaluation, and possibly get them care? How do we make sure that if somebody presents to the clinic, they know what to do? I know all our phones direct everybody to the crisis line, which is critical, because if you can't get a hold of somebody, that's always a default. But we'd also like to make sure that families know what are the local resources. So we want to work with you to get that word out. And we know it's a challenge here because there's not tremendous mental health services in South Jersey. So how we communicate about all this is critical. I mean, we just had an incident not too long ago, and I can't tell you the number of hours that were spent. Thank God the veteran's safe, but trying to get them into a mental health facility. It's hard. So that's where I think we've got to get our voice and get our elected officials and other people working with us to figure it out. Harry, so I got one more, but go ahead.
I got a personal experience about the mental health after hours or whatever, where they sent you from per day, or Cape Fear. What you gotta do is go to Cape Fear and they'll put you in the backup room and send you to a wild up and down with. But
there's a bigger mental health presence already planned in the clinic and adding staff. And I think that's where we also need to talk about what's that going to be. A lot of people think that's psychiatrists, but it's not. It's what did we just hear on one of the staff calls, Cindy? What did the staff say was one of the most important positions for mental health to have on their team? The therapist and the nurses, right? Folks that can engage, but we need more therapists. We have a great partnership, where's my friend Dave, with the vet center. But it's not enough. We know it's not enough. And then what's the right expertise? Where's the expertise for substance abuse and co-occurring disorders? They're the things we want to build up, but we need to hear from you, you know, where are the gaps? What are the things we need to do differently so we build this service up more? And not just here, because we won't be able to do everything in Cape May County, but if we come up with a system, we can look at Gloucester, Cape May, Northfield, Vineland, and come up with a model that makes sense and does a better job of creating the safety net that some of our more vulnerable and at-risk veterans need. So these partnerships with the county and using those services are critical, and then our staff to be available to help. I mean, I know for a fact folks were on the phone up to 7, 8 o'clock at night the other night trying to make sure we got a veteran safe and out of harm's way. It happens every day, but it's got to get more efficient because it's hard on families and it's certainly hard on the veterans, and we've got to come up with a better model. There's no mistaking that. But I think you've got a team committed to doing it. And I've talked to the folks in Philadelphia. They're committed to working with us on this as well. We know that we've got to get a better safety net, and it's got to be a partnership between VA and the communities. Yes?
I just wanted to add to that, having Prosecutor Sutherland here and Joe Landis here and the Hope One vehicle. And there's a great partnership now with VA and law enforcement in the steps and the processes of, especially with diversion. There's a lot of great things that are going on, but I think nobody really knows or nobody understands the back side of what's going on, because a lot of it, there's a lot of privacy issues and things of that nature. But for everyone in this room, please understand that, you know, the Wilmington and the Southern New Jersey team work closely with law enforcement when there is a crisis or something is happening, so that we are aware and we are involved. So just, I want everybody to know that.
You know, the other thing I think that we could talk about more and start to think about how to do differently, other parts of the country, because not everybody wants, you know, not everybody's comfortable with a mental health person. I came out of that world, so I can say that. You know, I'd like to see us exploring more peers. Vets helping vets. I think that's an untapped resource that we could do a better job of. And there's sites across the country that have set that up, where they have vets helping vets, and vets engage when there's a crisis, and vets help families. VA's hiring more peers. I think that's a resource we haven't tapped into as much in this community as we could. We're committed to trying to do more of that.
That's a good segue.
Yeah.
I'm Jeff Sutherland, I'm the county prosecutor, and Lieutenant Landis is a detective in our office.
They might want you over here because I've already disrupted them with moving around. So my apologies. Here you go. He's got you. Oh, sorry. I got you back too.
All right, now I got him.
You got it. You're up here.
I got a tether.
Front and center.
Hi, I'm Jeff Sutherland. I'm the county prosecutor, and what they were referring to is there was a law passed for a veterans diversion program, which allows prosecutors to engage with veterans who may, unfortunately, get involved with the criminal justice system, so we can get the help they need, which isn't most of the time going getting incarcerated, for instance. So the problem is the program. I'm going to go over the program. It's a very good program. It has some limitations, which we're working on. But the way it's structured is I have an assistant prosecutor assigned to handle any of those cases when they come in to be screened. He's actually still in the Army Reserve, and then Joe Landis is a Navy veteran. He's the detective assigned to deal with the veteran. But part of the program is having a mentor for the veteran that's engaged in the criminal justice system. And there's a one-day training program for it. I actually went through it last week. If they had it in Cumberland County, it was like a 7-hour program. Fortunately, it wasn't advertised to me from the State Department of Military and Veterans Affairs. I got a letter like 2 weeks before it was scheduled, so it was hard to get a lot of people locally to go. But there was probably about 25 people, and the veterans go and they get trained on how to engage with the judicial system and to be a mentor as they go through the program. So anyone that's interested, afterwards, give me your name, number, and email, and I'll make sure the next time there's a training that you can go to it. But let me talk a little bit about the program. So it is limited as far as certain offenses. They're supposed to be nonviolent offenses, unless it's a simple assault or repetitive disorderly, and it can be up to a 3rd-degree offense. Now, if that's the case, then it goes through the normal course of the program. I'll have Joe talk a little bit about how we've already had it for a year, and we had put through how many people so far?
We put through three and 4 is going to graduate now, so 4 graduated already.
Okay, so we had 4 graduate from the program. So they met all the criteria of the program. They filled out an application. There were offenses that were low enough that they qualified. They have to show they get evaluated for mental health. They get diagnosed with some involvement with mental health, post-traumatic stress or whatever. And then they go through a 6-month program. It's administered by my office. It's not overseen by the court, although we do have a judge assigned, Judge Delory, who's a 20-plus year Navy vet. That is the one that they would appear in front of it. They had, for the part of the program until they finally graduate from the program. So if they go through the proper treatment and they meet all the requirements, we try to do it within 6 months, and at 6 months, any charges that were against them are just dismissed. And we actually had kind of a graduation ceremony. Joe Griffiths was there, Bill Davenport was there. Judge Delory comes down off the bench, congratulates them, thanks them for their service, and they get to talk and address everybody there about how it helped them. And I got to tell you, the guys that went through it, really, one guy was very emotional. He felt it like turned his whole life around, and now he wants to be a mentor. So in addition to that, I'm pretty active in trying to expand the program. I do have discretion as a prosecutor, so we have had some instances where veterans maybe didn't meet the qualifications of the program, and we still do take every step we can to help them. So I can't talk about a specific case, but I'm going to kind of give you a scenario that we just came across this week. Department and was in distress, and he was looking to reach out for help. Unfortunately, because of his mental state at the time, he had to be engaged with law enforcement. The police down there did a fantastic job in getting everything under control. As soon as they got him under control, even though as part of it one of the officers was injured, all the police wanted to do was help the guy and get him into care. So I was involved. I was on the phone with Jackie. Joe Landis was on the phone with Jackie. We got to court to work with us so he didn't have to appear in front of a judge. He was taken to Cape Regional, and now we're trying to get him placed. Again, he has charges against him, but if he takes care of his obligations, and his obligations himself, basically, his obligation is to make sure he gets gets the proper treatment so he doesn't have a situation like this before. So even though the program seems a little limited in the types of offenses that you would go through the program as defined by the law, our office is very engaged in making sure that if a veteran gets involved with law enforcement, that we do everything we can to get them through the process and come out better than they were before they entered the process, and then go out and help others that may be in the same position. Because as you know, we have a lot of young veterans, and obviously there's not a lot of young veterans here. I know a lot of you that are involved in the American Legion, the VFW, are always trying to get young members. I'd like to, if you have mentors out there and you can work with some of these guys, because I think the oldest participant was, how old would you say?
Probably 68, close to 69.
And then most of them were,
18, well no, about 20, 23, 24.
Yeah, I mean, there are a lot of younger veterans. So if we can get them engaged with a mentor from one of your organizations, then that may help you get more involvement with your halls, and it helps everybody. They realize they have another place to go that maybe they didn't really know about, or they knew about but they maybe just didn't feel comfortable coming to. So I'd like to kind of work both ways in that, and and the program's been great. The work we've done with the VA, they've been very helpful and were very available. We were on the phone through the night trying to get it placed. Obviously, I'm the guy who's supposed to be prosecuting him, so I'm limited on what I can do. But I called the public defender up, and he and I worked well together, and he made sure that the veteran did what he had to do to get in the proper care. So these events happen. They can happen any day of the week, and we're available to try to help them. Every law enforcement agency is aware of it. They've all gotten a directive that explains the program, tells them what to do. They ask the person if they're a veteran. Once they know they're a veteran, my office gets notified, and then we go from there. So Joe, why don't we kind of walk through a scenario if somebody comes in, like how it happened the first few times.
So typically, if to trigger most of it, what happens is somebody's arrested, they're charged with a criminal offense. They'll be asked by all the police departments now, if they're a veteran, there's a box that they check right on the actual complaint form, which will set up a red flag if somebody else doesn't catch it, for us to catch it. But normally what would happen is once they're charged, they'll go to the public defender, or they'll get a private attorney. They'll find out that they're a veteran, or they'll ask them, and then they will ask them if they are haven't been diagnosed with anything, or if they're suffering from anything. And if they're not, then as long as they have they meet the 3 criteria, they just fill out an application, which is online. We made it as simple as you can possibly get. You log on to our website, everything is fillable. It gets sent to my office. I review it with the AP, and if the crime fits, that they're eligible. If they have a diagnosis already, but even if they don't, that doesn't preclude them from getting in. We'll send them to get a diagnosis if they say that there's something wrong. So we'll set them up with the VA. We have a bunch of different connects that we call. They'll have them evaluate it, and then if they meet that criteria and they are a veteran, and a lot of people, maybe not you, but people are misunderstood about veteran. Veteran doesn't necessarily mean you had to serve in a time of war. Believe it or not, a lot of younger people think that, as did I at first. Even though I did, a lot of younger guys I know who've never even been overseas think that that doesn't classify them as a veteran. It's anybody. As long as you served and you were honorably discharged, the only we won't take is a dishonorable discharge.
Actually, it's conditions other than dishonorable.
Yeah. So we'll take all of them. So if they fit that criteria, we'll immediately get them evaluated. The VA, or if they don't have the benefits through the VA, but they have an eligible discharge, we have partnered with Cape Counseling, so that Cape Counseling will take them on. We'll evaluate them, which we call a task evaluation in drug court, which means they're going to sit down with a therapist, mental and substance abuse, diagnose them for what they need. They'll put them into a program, and if they successfully complete that program, they'll graduate, the charges will be dismissed, and they'll be on their way, and we'll help them with whatever else they need. But it's a very simple, I mean, the people that we've got in have had no issues as long as they do what they're supposed to do. You know, it's just like drug court though. We can give people in drug court the tools, but going to drug court doesn't make you recover. You have to want to recover. So if they don't want to successfully complete the program, they're going to fail. You know, so that's why we need mentors. Mentors is similar to a sponsor in drug court, is a sounding board. So when you're about to fall off and you're having those bad times, pick up that phone and call your mentor, and maybe you'll go have a cup of coffee and say, listen, we can do this. What's the problem? And try to keep you on track. But we need people to sign up to be mentors. And that's another problem throughout the whole state. And another problem with this is funding. We do all of this on our own at the county level. We get no funding from the state whatsoever. We have no probation officers to monitor these people. I am a probation officer for that. Joe, I see you got your hand up, but give me a few minutes, all right? Because I have some other stuff I need to address first. Hold on. Just give me a few minutes.
He's on a roll.
We have no funding from the state, Okay? We do everything at our level. We monitor them. We try to get probation on board, but they cannot give us somebody and monitor somebody on the veteran program if they're not in probation. Because it's a diversionary program, they can't give us a free probation officer on their own time. And we can't pay them because we have our budget set on other stuff. So we now make sure that we cover that. And we're doing it. But it does get complicated.
Hey, Joe.
There's 42 states that have been running veterans boards for the past 16 years. When a veteran comes into your pretrial intervention program, do you notify the VA?
Yes.
Yes.
Okay? If we did it right here in New Jersey,
Can I stop you for 1 second, Joe? Because we've had these conversations in group and personal, me and you, and what did we talk about? Baby steps before big steps, right? I know Philadelphia has this great program, but we have something now.
like you're standing up here saying that you're going to raise the money. The minute you know, and listen, Wilmington, Delaware has been part of the VA program for a dozen years, 15 years. They're the ones who reimburse you the money. You don't have to go around having beef and beers. If you're registered right with the VA, they
Well, we
become
can't have
the
a beef
ward.
and beer.
They become the ward of the veteran, not the county, not the state. And then you get reimbursed for a lot of your expenses. If you have to put the veteran up in housing, get them anger management, get them substance abuse, get them AA treatment, the VA picks up all that time, not the county. We're just doing it ass backwards. We're doing it at least, but
Thank you for at least
you're standing up, you're talking about you gotta raise all the money the county's doing. Chris Burnley didn't get on the table.
So I think the point of the presentation was to A, show the growth, the fact that this resource is available. But then again, I'm going to go back to my comments about it takes all of us. And yes, VA can do things, we can link. In fact, we're providing treatment, we're providing case management services. Our outreach team is actively engaged with your office, with the local municipalities, all of that. Our homeless programs are engaged. Our programs that we're growing for employment services are engaged. We're going to have to continue to leverage these things.
Right.
So
I have discretion to do that. I've done things beyond what's the statute lists because I'm allowed to do that. I actually met with Senator Andrzejak today because he was one of the sponsors of the bill, and they tried to get certain things in the bill, and they got pushback on it, such as a crime that may have a violent element to it. Just for instance, if a veteran's out and really what they're trying to do is hurt themselves, that's a violent crime. And if it involves a law enforcement officer, it's an extra degree. So what would have been a third degree is now a second degree. So things like that, we went over, and he's fully in support of making those changes if you can get them through the legislature. I also suggested maybe you can put something in there that just says if the prosecutor exercises discretion, you can still use whatever infrastructure that is set up under the statute, even if the person doesn't qualify under the actual letter of the law. So we're like, now we have a year under our belt. It makes it easier for him to go back and say, look, we tried everything and it's working, but here's things we can improve upon. And so I had that meeting with him today. I met with his chief of staff, and honestly, the situation we dealt with really, considering what we were faced with, went really well. The law enforcement, perfect the way they handled it. The toughest part was the mental health issues. The longest thing it took was trying to get the poor guy placed somewhere. Now, since I'm the prosecutor, I can't really engage in getting services for him because technically he doesn't meet the requirements. I'm still obligated to prosecute him. But, the public defender's on board, and Eric got right on, like I called him last night at 9 o'clock. I think he was out at a fire. He's a volunteer fireman, and he immediately called Cape Assist just to confirm that it was okay to transfer the person. So, everybody in law enforcement on both sides of the aisle are working to help a veteran whenever we can. They still have to comply. There's still charges that have to be brought. Sometimes the best thing that happens to them is getting a charge against them because now they have a reason that maybe the sort of Damocles to get them to where they are to get help. Their compliance is basically getting themselves help. It's not like we're making them jump through hoops. It's basically making sure they follow through with their needed assistance.
So if you know folks out there, part of your agencies, part of your communities that are willing to be mentors, I think it'd be great to continue to try to look at how do we add resources here to help our veterans.
Can I just add one more thing real quick? No, I don't mean it because I
Sorry.
can talk forever, but. So I just want to also let everybody know that we have another program in the county, all right? It's called Hope One, and basically it's a vehicle that was donated to the prosecutor's office by the county freeholders. The prosecutor then took forfeiture money and basically re-outfitted the entire truck so that we could partner with Cape Counseling, Cape Assist, South Jersey AIDS Alliance, and now the VA. I've got Jackie on board, and Cure Ministry, the Cape Regional Medical Center, which I also will say it's a very good hospital. My wife's an emergency room nurse there. And I trust her. So we travel around the county and basically set up in different locations, and we try to go directly to the people in the street and bring them the services they need right then and there. We do free Narcan training, and I know some people are against that and say, you know, why Narcan, these junkies, you know, blah, 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 blah. But unfortunately, we live in a world where nobody cares about anything unless it affects you directly. So if you never had it affect you, then you would probably be one of those people that says, why Narcan, those junkie? But if you had that in your family, you would say, hey, that's my loved one. Just like the VA being on there. Some people will say, why are we driving around helping the veterans? They probably don't know or have a veteran in their family. But the minute they do, then it's like, why are we not doing more? Why do we not have more funding? Why are we not have 3 trucks? So if you see the truck out there, please tell somebody to come see us. The prosecutor went well above and beyond with this program. He went to the Defense Council in our county and basically worked out a deal with them so that a lot of these people on the streets have warrants. They can now come up, and I have the ability to call and rescind some of those warrants so they don't have to be afraid to get the services instead of going to jail. So we provide a lot of services. Like I said, and I tell Joe and many other people, little steps before big steps. My little truck maybe will be a big truck, and someday we will bring it all.
Well, so let me just say something, and I want you all to recognize the prosecutor and his staff and the sensitivity that they've had here. The prosecutor and I had a long conversation this week, as a matter of fact, on this very issue. So please understand that when they say it's a first step, but it's a significant step, and they should be commended for what they're doing, and I mean that sincerely. And another thing that you should recognize, Cape Counseling is a 24-hour service. They have counselors that they call 24 hours a day to respond, and the hospital emergency room are the ones that take that initiative. But again, I want to really commend the prosecutor and his staff for this program, because it's really well done, and he has a sensitivity to our veterans, and they're really working hard to maintain that sensitivity, not only with him, but also with the courts. So well done, you guys.
So again, I think the theme was it really has to be about partnership. It has to be about community coming together. What we're committed to in VA is making sure we're a part of this community. We feel like good things are happening. We know more needs to occur. That's why we're having these conversations with you. We want to make sure that we get you the services you need to be healthy and to feel appreciated for the way that you have served our country. So I want to kind of see if there's any other questions, but I also want to take a minute or two just to remind everybody that this year is the 100th anniversary for the Legion. And you talk about service in the community and what the Legion has done for this country and what this Legion does for the community. You know, that's what it's about. Thank you to Vince and Harry for your leadership, for hosting us tonight, and for being some of the strongest advocates that we've had, and really pushed VA to try to get services here. This conversation about VA needing to do more in South Jersey has been going on for many years. And many of you have been a part of that fight. You've been a part of that voice. You've been challenging VA to do more. I think we're answering the call, but we need to make sure that what we now do meets the needs of you today, but that we're also planning for what are going to be the needs for tomorrow, so that we leave that legacy of service like the Legion, that we're taking care of those that come behind us. So thank you. Thank you, Vince and Harry. Yes.
Just one final statement. All these programs are terrific. Advertisement, brother. Put it in the Herald, put it in the Press of Atlantic City, put it in the Inquirer, have them join the VA, give them the hot numbers to call. We need to advertise what you offer.
Yes.
And what we offer.
Well, I'm going to be quiet because I think Brendan's kind of walking up, and we've had this conversation today.
I can be a talker too, so I'll try to keep this brief. But the one thing that I think is the most challenging when it comes to communicating with veterans is that, you know, you go shop at the Gap and they target an age group of age 24 to 34. Well, the VA, no, we have everybody topped because our target audience is age 18 to 115. So we have to communicate in multiple different ways. Some people do Facebook, some people still have a landline phone, some people like things in the mail, and it's just trying to get that message out, and we have to do it in multiple different ways, and we rely heavily on the community. In my former life, like as Vince said, the last 6 years I worked for a U.S. Senator, and the one thing is and Mike Francis will probably agree with me, a lot of the people who called to get help with veterans benefits was not the veteran. It was their cousin, their aunt, their brother, their sister. It was people in the community that were reaching out to them, and that is the most critical thing. You can have all this technology, the word of mouth is powerful, and everybody here and everybody at the VA has an opportunity to make sure that that message gets out. So if you see one of our posts on Facebook, you know, if you're on Facebook, you can go right on our page and suggest to all your veteran friends that they come and like our page. Because it's not just to put out, oh, we went to this event or we did this, but we're putting out information about suicide prevention and all the other benefits. I met a veteran who came to me to help get to buy health insurance on the marketplace. He had lost his job, he couldn't work, he was going to pay $1,500 a month. He mentioned he was a veteran. He had served in the Air Force, and we said, have you ever gone to the VA? Never. And the guy had served in the 70s. Well, that guy today is paying $8 for his copays, $50 for his visits. He was going to pay $1,500 a month and bankrupt him. But not only that, we got his records, and he actually went to sick call, because who in the military ever actually went to sick call? No. You know, you're part of the sick call rangers. But this guy was an Air Force medic, so he was working in the hospital, so he did go to sick call every time. And the reason he couldn't work was more than likely linked to a bad flu vaccination, and this guy's going to get 100% disability now. So if his adult daughter had not called and said, hey, you know, trying to help this guy, he'd be broken on the street. So, you know, we're going to do everything in our part to communicate the benefits that are out there. But, I mean, the truth is, in the military, you could never get paid. You get paid any dollar amount that you can name, but it's never going to be compensation for what you did for this country. Just, it's true. And the same thing with the VA. You could give them the largest budget out of every agency, and it will not be enough to say thank you for what you did. It's just not possible. So, you know, the bottom line is we're going to do our part to communicate. If you see us falling short, hold us accountable, because we all work for the veteran in Wildwood, New Jersey, and our goal is to make sure he or she knows what benefits are available to them, because unlike some other countries, there are so many benefits that are out there. I mean, there are countries that if you get in a car accident, they're not even going to send an ambulance to the scene. I mean, that's the reality. And the only other thing I would say is, you know, I'm here in the summer down at Sea Point, so you can come down and see me. I'll be at the Crest Tavern every night. Just come and find me. You know, you can talk my ear off. But, you know, the truth of the matter is, the folks in South Jersey are lucky compared to other parts of the country. I lived in Arizona for almost a year at Fort Huachuca, and I had to go all the way up to Phoenix to get VA care. That's like driving from Wilmington, Delaware to Wildwood, New Jersey 3 times. So, and that was the option that they had. So on the East Coast, you know, it's still not the best, but as Vince says, we're always doing better, and we're always moving forward, and we can't move forward without you. So please help us communicate that message. When you see us putting out information, you know all the veterans in the community. Get them to like our Facebook page. We're all on the internet. We're going to try do our best to communicate in other manners with outreaches like this, but we need your part to help us communicate that. You know.
And you're going to be trying to meet with the different journals and print as well as radio to kind of get the word out there. There's no question we have opportunities to improve on how we get the word out there. One of the things I say to our new employees all the time is there's probably not a stronger veteran or a stronger network in the country than the veterans. And that what you tell your fellow veterans means more than anything. So I think if we combine this with what Brendan can do in getting to the outlets and you get the word of mouth out on a daily basis, I think we'll continue to grow and improve how we're taking care of our vets. I'd be remiss before we end. And tonight we talked a bit about some of the gaps in services. And tomorrow, and I'll ask Cindy to talk about this a little bit more, we're going to be having a memorial service at the Northfield Clinic starting at 1 o'clock. And it's to raise awareness that for some of our veterans, and tonight we talked about veterans that are fighting the war after coming back from service with addictions. Others fight demons from mental health and have lost that war to suicide. So we need to be vigilant around that. We need to make sure that we understand how all of us can reach out and help veterans that are in distress and create a more hopeful reality for them and for their families. The pain of suicide affects communities for generations deep. I know it's affected the VA community. I know it's affected our communities in Atlantic County with the tragedy that we experienced. So tomorrow is an opportunity to remember those that have lost the fight to suicide, but to also talk a little bit about the hope if we continue to work together and we grow these services, that we can make sure that we stop this tragedy. So Cindy, you want to chat for a minute or two?
Well, it does take much time, but we have an opportunity to show the world what South Jersey is made of. Out of the great tragedy, there was quite a network of individuals in this community, all of South Jersey, to come together and say enough is enough. 22 a day and counting, we're losing. So there's a organization, if you've all heard about it, Flags for the Forgotten. So the widow of Charles Ingram got together with those folks just in the past few weeks, and they've come together, the church that's in front of our clinic, the clergy, the community folks, my Paul Sutton here, who's a grand advocate for everything, all kind of got together, area leaders, VA, everyone, in a too sweet moment because that young woman called and said, would you help me honor my husband's memory, but would you help me to honor the families who are going through the same thing? So the Flags for the Forgotten will be placing 660 flags. The installation will begin at 10 o'clock in the morning. At 1 o'clock, we're going to have a remembrance ceremony. There's some dignitaries will be there. Congressman Van Drew will be there honoring us at that spot, but many others. This is not the VA's issue. Who owns the VA? We all do. I'm a daughter of a veteran. Each one of us, whether you served or you didn't, there's somebody who did. And the VA belongs to this community. It doesn't belong to the VA employees. It belongs to you. We just get to work at the VA. And the tremendous burden, and I'll tell you that, I have my partners here today, of losing people that we love dearly, that we attempt without end to save them from that precipice. So we're with you in that, but we can't do it by ourselves. It takes all of us to do this. And I just can't tell you, gives me goosebumps, about what this community did, Southern New Jersey, Cape May County, Atlantic County, Violin, my partner here, who's coming in and to help with this. It's just an amazing thing. I've gotten letters and calls from people all across the country and across the globe. How did this area do this, to go from such tragedy to be able to provide services that are needed, to be able to partner with the veterans, to criticize us, tell us what we're doing wrong, but you're part of the solution with us. We're all part of this. We're one big family. We're all Americans. So tomorrow, if you can think about this young family, the Ingram family, but think of the 660 families that every 30 days are suffering the same as Miss Ingram has, the same as we have. Other VA employees across this country are desperately trying to do something we cannot do by ourselves at all. You've got to partner with us and stand by us. So tomorrow, think about us or come and join us. I believe it's going to be something that people will want to see. It'll be up for 30 days to remember 30 days, 22 a day. So please come, tell people about it. The Northfield Clinic is 1909 New Road in Northfield. The church that sits right behind us, it's their pasture, their field. And we will be there. It's right where the memorial bench is. That memorial bench was donated by the wife of Charles Ingram. VA didn't pay for anything. She did it on her own. And I can't count anymore. I used to be able to count the amount of people that find their way to that bench from all over this country and then find their way into our doors. And then Jackie and whoever else is here makes the way to make sure that they're not forgotten. Okay? So thank you all. I can't tell you how proud I am just to be a girl from this area. And all those partners coming from these other states and places to come and help us. You know, we can do great things together or we can tear it down together. So I just can't tell you how much I'm so grateful that we're building this up and we're showing the nation how it can be done because we're Jersey. Jersey can do it. Yeah.
All right, I'm going to get us wrapped up. But before I do that, I'd be remiss not to mention and recognize the county and how you've stood up and continue to stand up every day. We would not be making the progress. We wouldn't be talking about the services. We wouldn't be talking about a new clinic if you didn't step forward and take the leadership role that you're doing. It is one team, one fight. And we appreciate how you stepped up because I know this was something our veterans wanted. It was difficult to identify an entity that would lead the way for the development, and you guys raised your hand and said, we're going to walk the walk and walk the talk and making this happen. So thank you to the county for stepping up. Anything else before we go? All right, I really appreciate everybody coming out. We'll continue to do this monthly here to kind of keep you apprised of what's going on. Not only in the development, but on the other changes in services. Please get the word out. Let veterans know, especially our female veterans and our younger veterans, that we're willing to partner with them and find ways to get them the care that they need. Thanks, everybody.